expounding more on this conversation. A very good morning, Mr. Joseph Kabuleta.
Very good morning to you, Romeo,
Indeed.
and to the viewers.
Indeed. Now, Joseph Kabuleta and I are going to be expounding more on government's interventions during this COVID-19 induced lockdown. We do know that on Saturday, a 35-year-old mobile market vendor passed on. His name was Mr. Katongole. He was going to Mitiana Gombolola grounds to actually receive some food, courtesy of the Mitiana Municipality MP, that is Francis Zaki. Now, half a kilometer away to the food distribution point, he collapsed and died. Now, so many of our Ugandans find themselves in that state of debacle that this young man found himself in. When he couldn't find any food, he was starving in his home without any help finding him. But when we heard of someone distributing food, he actually left his home and decided to walk there, but he did not make it. He died on the way. So how many of our Ugandans are grappling within their homes and are starving in that regard? How many of those whom we thought in the villages are actually tilling their gardens and are not, and are actually starving right now? So that's the conversation we are largely having right now. A very good morning, Mr. Joseph Kabuleta.
Good morning.
A very, very long preamble into this conversation, but help us understand how we got to this situation. COVID-19 induced lockdowns. By the way, do they work?
No, they don't. They don't, and what I'm saying is not my opinion.
Indeed.
It is an opinion of a scientific study that was carried out by Stanford University and was absolutely peer-reviewed and carried across the media world. And it said, and they did the study by reviewing countries that instituted the most draconian lockdowns, as well as comparing them to those that didn't, like Sweden, like Tanzania, like Croatia, like South Dakota in the US, which had absolutely no COVID restriction. And now when they look at the number of infections and deaths per capita, they actually came out to the conclusion that the lockdowns did not help whatsoever. And then they actually looked at all the other impacts of lockdown, depression, suicides, and all the other deaths. In our case, of course, depression comes out in a different way. We're reading here a story of a man who went and chopped his brother and went and declared himself.
Over a pair of oxen.
Exactly. And so depression comes up in all sorts of ways. Domestic violence, deaths that could be avoided, people getting angry because they are being denied their normal lifestyle and they cannot go and earn, and all the frustration.
You're doing well, I'm not doing well. Such stories
like that. For us, it might not so much lead to suicides, but all sorts of depression. Now, there are so many things that come as a result of lockdown, and I've never believed that we should lock down an entire society of a sickness that is not even in the top 10 killers in Uganda. Now, that is a statistical fact. It is not my opinion, and the thing is that we are losing so many other people as a result of trying to prevent COVID deaths. And the unfortunate thing for people who support this kind of measures is that they have settled it in their mind that there are deaths that matter and those that don't. So if there are children dying of malnutrition and because they can't get to hospitals and get care for, and learn how to, resuscitate their children and so on, it doesn't matter because they are poor people from slums and villages and so on. It doesn't matter. But COVID kills the people who matter, that sort of thing. Now, that is the origin of, a decimation of society. When you start thinking that there are deaths that matter and those that don't. Now, I don't ever want to bring myself to ever think in such a way, because that disqualifies somebody to be a leader. The minute you start thinking that your death matters more than somebody else's, or that you are more, and even this terminology that we've adopted in this thing, that essential worker. I mean, who is a non-essential worker? Now, try telling that man who died on his way to getting food,
Katongole Thomas.
Katongole, or try telling the man who is looking at his children who are starving and he has no food to feed them.
8 children, 3 wives.
8 children, 3 wives. And they are looking at him. He has hands, he has, feet, he can go and earn a living, but he's been locked down. Now try telling his children that he is not an essential worker. To them, he's more essential than the president and all the cabinet combined, because those ones are not going to feed him. This man is going to feed him. So every worker is essential.
Indeed.
Now, when we take on this whole thing of some people are non-essential, and yet they have families to feed, and they have dependents and so on, and then we pretend that we have the necessary, structure to put out some sort of, social,
social protection tools.
Yeah, I mean, for the vulnerable people, we do not have that structure. We've said so many things that were never done. I mean, there was money that was released for buying radios. Nobody received the radio. For televisions, you remember that?
Indeed.
Nobody received the television. So people were asking me, shall we get the money? I said, well, good luck. But if you got the radios and the TVs, but some people, I know people who have gotten the money, and that's good. But that's just a drop in the ocean. There is so, as you see your statistics saying, the 7 million, you know, who are vulnerable. There is so many more people who live hand to mouth, and we cannot afford in this society. You see, there's even a time traders would try to demonstrate, you know, against something. In 3 days, they are hungry, and they give, I mean, they forget about the demonstration and they go back to work.
Yes.
3 days, now you're locking people up for 42 days without any form of help. And now I even saw, when I was sitting waiting to come on the show, that they're even planning to stop the distribution of food by, you know, individuals, members of parliament and so on, because apparently they have an issue with it. Wasn't that part of the headlines here this morning? Now, how callous can you be as a government, really? Because these are people who are not supposed to be distributing food. They are legislators. They're supposed to be in parliament making laws. But they have gone out of their way to help people because there is a need, there is an outcry. Now, even that, you have a problem with it.
What is government more afraid of? That these politicians might get more political clout with their food distribution programs during this very strenuous time of COVID-19, and that's why they are stopping them?
Yes, because they make government look bad.
I see.
Because they make government look bad. Because they, and you see now in the state that we are in, the kind of government that we have,
yes,
anybody that comes out and actually cares about people and demonstrates their care for people is making government look bad. And it's, I was looking, and I was actually waiting for this to happen.
Indeed.
Because it was widespread. People were, you know, looking away from government and now looking away from Nabanja's, you know, much debated 100,000. And they were looking at their members of parliament who came through, and very nice things. But now government stands and says, no, 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 these people are making us look bad. And it is not about helping the people. It never was with this government. So the whole thing is this: the only solution to the whole fiasco is just end the lockdown. It is not helping whatsoever.
But Mr. Joseph Kabuleta, we've seen a reduction of COVID-19 cases as a result of this COVID-19 lockdown. Before we had instituted the same lockdown, we were recording cases within their thousands on a daily basis. Hundreds of people were dying on a weekly basis, and then that has reduced during this COVID-19 induced lockdown. Don't you think it has done some good?
Here's the thing. First of all, that's not true, what you're saying in terms of the numbers. But then also, secondly, how can you say that that is because of lockdowns? Because all COVID outbreaks, they come. I mean, all epidemics come, they peak, they plateau, then they go down. So you cannot necessarily say that it is because of this mitigating measure that we put in place. That's how all, you know, it has been happening in other places. Yes. Because even when there was no lockdown here prior, I mean, the numbers would go up and would go down. And so when there is a new wave, we expect them to go up, we expect them to go down. That's just the way it is. So we cannot tie it down to the lockdown, especially since, as I told you, some scientific people say that actually the lockdowns did not help. And then also, you know, that there's not really been, you know, the real institution of the lockdown the way it was the first time. Yes. Now there's been a lot of interaction among people and so on. It's just that people are not working, just that public transport is not working, and we are in a society where we cannot afford to have public transport not working. Because as a result, so many women are not going to get to hospitals to deliver their babies. So many people are going to die of preventable sicknesses because they cannot come to starvation because they cannot go and work. All those people who are locked have families, and the government does not have the capacity to help those people. It doesn't even have the interest, as far as I know. So why don't just let them just end the lockdown? It was a mistake in the first place. And actually, it is up to us to make sure that the word lockdown is never mentioned again in our vocabulary after this, because it has been a total trauma. It's a traumatic experience for so many people, and I've interacted with people and the suffering of people, and we cannot let this happen again. We cannot let the president think that he can sit in his comfort like Mother B and start instituting his directions when it does not affect him. So the whole point is end the lockdown, let people go and work. teach people how to avoid the sickness, teach people how to identify the symptoms, go for treatment. Everywhere across the world, people have come to the conclusion that we have to live with COVID.
But instead of a sensitization campaign, we've seen a different approach coming in from government, the heavy-handedness or the high-handedness of the security forces. Do you think high-handedness can achieve behavioral change, as government is actually purporting right now? Can we beat people into submission?
Well, you can beat them into fear, but you have to explain to them how it is they can avoid, getting sick. And if they get sick, because I believe ultimately, I mean, so many people will get sick, how to handle the sickness. Thankfully, the sickness does not have a very high mortality rate, okay? It's across the world, the number of people, percentage of people who recover are 99.72.
Yes.
The deaths are only 0.28, and that's worldwide.
Yes.
Okay, Uganda, the figures are a lot more encouraging. So thankfully, that is the case. So we can encourage people on how to go about it. Then secondly, the school children are at very little risk. Okay, even in other countries, they are not being targeted for vaccination because of the very little risk. Even when they get COVID and they test for it, it's mostly asymptomatic, and there's not been any significant deaths in that area. So let the children go to school, because it is affecting them so much, and it's going to affect them. I mean, we have depressed children and so on, and just let them go to school. And then afterwards, we can, work around, going around with this pandemic. Let me tell you something.
Go ahead.
In the UK, they decided yesterday, Monday, July 19th, as the day that they remove all COVID restrictions. And they said, and I listened to their, health secretary, and he said that we have, it doesn't mean, there is no date we shall set which comes with no risk. Whatever date we set comes with risk. There will be people who get COVID, and unfortunately, the people die. But we need to get our businesses rolling. And our business community needs to know that now we have started, we are not going to stop again. Because we can't be in start, stop. Now the COVID numbers are, now we're locked down. Now then nothing happens in terms of business. Now, to know how much this tyranny has affected people, let me finish. I was seeing pictures, because it started on midnight, on Sunday night.
Yes. You saw the people in bars in the UK.
Lining up, because nightclubs could not open until midnight. So by 8 p.m. people were lining up outside nightclubs just waiting for midnight.
I was like, what has happened within the UK? And that could have been the big problem, in that when you loosen restrictions, the people believe maybe the threat is gone, and they just come up in droves.
Let me tell you something.
These are people who had not even been vaccinated, even though the UK has inoculated 6 to 8% of the adult population. But they were just not wearing face masks. They were in there, and we could see an explosion of cases, because even now, the UK is registering 50,000 cases on a daily basis. Yeah. They say in the summer, that number could go up to 200,000 if they keep up this trend that we are seeing right now.
Yes, but then also there's the bit about how many of those are leading to death.
Indeed.
Because there have been talk of Delta variant, Lambda, and so on. But when you look at the number of people who have tested positive for those variants, and the number of deaths, it is still very insignificant. So you cannot stop whole society because of that. Now, even people going and lining up to enter nightclubs and so on, it's because they have been tied up so much, and life has to continue. We are not going to stop living our lives.
Do you also envisage a situation where that also befalls onto this nation, Uganda, whereby we loosen restrictions, we say, okay, the 42-day lockdown is done, and then people just bombard the streets just like that, without any regard of COVID-19, face mask wearing and so forth, largely because of the heavy-handedness with which we used to execute the lockdown?
It's inevitable. It's inevitable. Every time you lock there's some pent-up desire to have fun, pent-up desire to go and people to express themselves. So you cannot stop it. But here's the thing. We have to learn how to let people take responsibility for their own life. That's what happened with previous pandemics. I remember I lived through a cholera pandemic, and at the time I used to stay in a slum, and there was very high chances of cholera. But we knew, they told people, do not eat cold food, do not do this, do not do that, and somehow, and killed thousands, bigger numbers than COVID, actually. Cholera, just something as simple as cholera, and it killed thousands. And there was a tent at Old Mulago where cholera cases were being gathered, and I was seeing people dying. So, but somehow you leave it up to the people to be responsible. You tell them, don't do this, don't do this, don't do this, and make sure improve your hygiene and so on. Then we lived through the AIDS pandemic. And we do not close lodges. We do not close, even if that's the place where so many people, caught the virus. We do not close anything. But we left it up to people to be responsible and tell them this is a killer, this can cause this, and we are seeing the death toll from AIDS. A lot of us who lived through that time were seeing it actually. So we had to take the responsibility by ourselves to be, and we lived through that period because they told us the risk, they told us the way to prevent it. You remember the famous ABC campaign, abstain, be faithful, or use protection. And there were all these things telling people about what, go and test, make sure you protect your loved ones, and so on and so forth. And that was a bigger pandemic than COVID will ever be, only it will not get the same publicity. But so we have to transfer the same methodology. And by the way, because of the responsibility and because of some people, I remember coming out and cautioning people, stars, even some stars who caught it. The numbers were reduced, and somehow it's not as prevalent now as it was then. Yet we do not take any, drastic or draconian measures. So the point is this: we have to live. We will all die, one way or the other, COVID or no COVID. Okay, the fact that we are alive means we will die. Now, we have to live while we are in the process of living, because we are not yet dead.
But then I had to be the bearer of bad news, Mr. Joseph Kabuleta, because the lockdown is still here. Why? We look at the factors that might actually force government or compel them to call for another lockdown. First of all, they called for this COVID-19 induced lockdown to be able to carry out vaccinations. That largely has not taken root. They wanted to vaccinate the teachers, the learners, so that we can reopen our schools when the learners are in a safe environment. Now that that hasn't happened, it means yes, this lockdown is going to be extended.
That it hasn't happened?
Aren't you afraid that this might happen? There could be an extension.
I would really, now any extension, because there's already been a death sentence on hundreds of Ugandans every day because of the lockdown, not because of COVID, okay? The death toll from a week of lockdowns beats the entire death toll of 1.5 years of COVID. That's a reality. So how long are we going to stop pretending that COVID is the only cause of death? How long are we going to stop pretending that there are certain people who are so important, their death matters more than others? How long are we going to know that? To take statistics, I was seeing even recently in the Daily Monitor that 10 people shot dead every day in the process of implementing COVID restrictions. 10 people every day. Now put that, multiply that by the 1.5 years that we've been in this COVID era, okay, close to 1.5 years, and guess what? More people shot dead than COVID. And those are shot dead. I'm not talking about those who die of starvation, those who die of hunger-related sicknesses, those who die of malnutrition, mostly babies, those who die of malaria because they can't get access to hospitals, the mothers who die giving birth because they can't get access to hospitals because of the lack of, the absence of public transport, and so on and so forth. Now, combine those deaths, and you see that lockdown is the most stupid decision that was ever made by the leadership of this country, and they've actually made so many stupid decisions, But this one is at the tip of it all, because we have to look at death and causes of death holistically. We cannot pretend like COVID is the only cause of death. That's where I have a problem, because our society is so fragile. Every interruption in our society causes people to die. People die even in normal times. The figures of people who die of malaria, childbirth, malnutrition are high even in normal times. Now they are exponentially high in times of lockdown because of the absence, especially, of public transport. Now, I'll tell you that you go to Mulago, there's that place called the acute ward, where they take malnourished children. Malnutrition is the #1 cause of death in Uganda, okay? #1 cause of death. They take there, usually they're about hundreds. You find hundreds. Okay, hundreds is an exaggeration, between 100 and 200. Mothers taking their children there. Some of them because of malnutrition, and you know how it's caused. Maybe the mother cannot breastfeed, and of course there's no food, so they start giving them this normal food that we take, which is not, absorbed into the baby system because they are not yet developed enough. Their digestive system is not yet developed enough to absorb that. So the child starts losing weight. The mother is concerned. We are giving him food, he's losing weight, but the food they are giving is not the food that his body needs. So the next thing you know, the child, actually some of them are in medical shock, already beginning to get cold in the feet when they come there. But because of that place there, they are rescued, They are given, some of them are given therapeutic milk, which revives them. And most of them in 2 weeks, because, you know, children, they go down fast, but also they get up fast.
Indeed.
Because in 2 weeks, most of them are back to normal life, and their lives are saved. And the mothers are taught what kind of food to feed their children, and those children survive. Now also, the Uganda Health Demographic Survey, down there you said, shows that 3 out of every 10 Ugandans, that could include you and me, are stunted. Okay? That means they never acquire their stature, the fullness of their stature. They're stunted. And the stuntedness can be extreme, you know, or it can be minor.
Indeed.
So which means it's possible that I'm stunted. Maybe I would be your height. If I'd fed well in the first 5 years of my life, and maybe you would be taller than what you are right now if you had fed well. So 3 out of 10 Ugandans, that's a damning statistic, 3 out of 10. But, and all these hundreds of children, now guess what? That ward where those hundreds of children go is now a ghost town. Why is that? Because no public transport. Even if the nurses were considered essential workers, they don't have cars to get there. So the nurses are not there. And of course the mothers are not essential workers. I hate to use that language because it is demeaning. Calling somebody who has a family non-essential, that's demeaning terminology. But anyway, the mothers don't bring the children. So guess what? Those hundreds of children who are saved every day, guess what they are doing? They are at home dying quietly. Indeed. Outside of the media blaze, outside of all the publicity that has been reserved for COVID. Okay? And yet there are hundreds of people, and the lockdown is a death.
People like Thomas Katongole.
People like Thomas Katongole, and now there are children, so many children, who are more vulnerable. Okay, the adults are vulnerable too. But now Thomas Katongole has children. Now what's going to happen to his children now that the breadwinner has died of hunger? Now imagine what is the children, because we are a lot more, you know, resilient in scenarios than children. So my question is, are we going to continue passing death sentences to young, poor, and, you know, apparently non-essential people, and we sentence them to death because there is something called COVID, which apparently...
All right, you mentioned poor, you mentioned
people.
poor, and then you put these children in a bracket that is not being considered as vulnerable by the government. And of course, according to you, both 8.3 million people are poor, but according to government, these people do not need government intervention. They say that these people should go for the poverty alleviation programs like AMIOGA with the Microfinance Support Center, like the Youth Livelihood Fund, the Uganda Women Entrepreneurship Program with the Gender Ministry docket. Don't you think these individuals, the 7.79 million people, should also be included within this vulnerability bracket and should be targeted with COVID-19 relief?
I think they should be let to go and work. That relief cannot cover 7.9 million people. We know it. Even the people targeted, I don't believe that they will get the money. Even if those people should go to all those programs that you mentioned, in the absence of public transport, the society is crippled, because how are they going to move? Okay, society is absolutely crippled. When you put a curfew, all restaurants reduce their workers by almost 75%, because a lot of the food is sold, you know, after 7. That's when most of the diners go there. And so people cannot sell in that time. How many people? In the time when people are working is when the restaurants are open, and people are not going to restaurants. When they are supposed to go to restaurants, they are closed. So, so many people have lost their jobs. 1.8 million people fell back into, you know, below the poverty line after the first lockdown. So we had made some strides of people who had gotten out of the, you know, under the poverty line.
Now they are falling back.
1.8 million. In the first lockdown, 1.8 million fell back. Now, after the second lockdown, wait for the statistics. They are going to be terrible. And these are things we might take 10 years to recover from. These 42 days, we might take 10 years to recover from. And it is so sad. I would want to look into the face of anybody at the Ministry of Health who went and told the president that we should do a lockdown. I would want to look in their face and have a decent argument with them and tell them what is the source of their logic. Or tell the Minister of Health, maybe they turn her title to Minister of COVID, because there are so many other health concerns that have been totally neglected because of COVID. Of course, we know there is money in COVID, and you know there's profiteering and so on, but still, do not push people under the bus because you want to profiteer from the virus. It's going to be here, by the way. There are still people who are profiteering from HIV, okay? And there are still people who are dying from it. So we can live with it, while the people who, you know, have gotten their jobs from COVID continue doing their jobs, but people are not dying of hunger, so that we stop having stories like Katongoles and so many others that I know, by the way, who might not necessarily have died of hunger, but of, there are so many sicknesses which if you have, you can't survive a lockdown. I'll give you an example. Look at people who have, type 1 diabetes, and they are poor. And then you tell them lockdown. You know how fragile those people is. Sugar is high, sugar is low, sugar. That's a death sentence. And somebody dies, and he could have been alive. If you could go and work, he has, money, he can eat when he has to eat. The regulated eating of those people, eat now, do what, check your sugar, check what, is it high, move what, inject yourself. Now,
insulin and so forth.
Insulin, now, that is lockdown is a death sentence to those people. And so many other people. So why are we doing it? Is it only COVID that is killing people? It's killing even small numbers in comparison. And I'm not saying that anybody should die. They shouldn't. Okay, we want all people alive. But in the weighing scale, we should look, are we trying to prevent COVID deaths and causing so many other thousands of deaths, which is the case? Is it even sustainable? So I don't even believe the president should wait the 42 days. I think he should end the lockdown before. Everywhere in the world, people are opening up. Everywhere in the world, people are coming to the conclusion that we have to live with COVID.
But reality check, that won't be happening, Joseph Kabuleta, in the absence of the vaccinations. That is the only key to reopening our economy.
The vaccinations, it is not the people's fault that they are not.
It is the government.
It's the government.
And the nationalism we are seeing in the international scene. Countries clamoring and buying all the vaccines and storing them, by the way, for future use.
I don't know.
At the expense of Africa.
No, at the expense of Africa, but it is not the fault of people. So you can't lock people up as you yourself go through all your bureaucracy and red tape to get vaccines here. Open them up. When the vaccines come, people will come and get vaccinated.
All right, let's go to Koboko. We shall return and compound more on this conversation. In Koboko, we are now joined by Rashul Adidi. He's going to be updating us on what is happening there as far as the Eid al-Adha celebrations are concerned. Well, in West African countries, it is known as the Tabaski Festival, and it involves a lot of travel, something that we are calling against within these countries as a result of the COVID-19 disease. Mr. Rashul Adidi, a very good morning, and thank you for joining us on Morning at
I'll tell you this. If you fly from Kenya, you have to have a COVID test certificate. You fly into Uganda, a flight which takes less than 1 hour, you have to come here and pay 250,000 shillings and to test you. All the people with whom you were on the plane were tested. It is a money-making venture. It's only in Uganda. If you come from Uganda with a negative COVID certificate and fly into Kenya, nobody is asking you to be tested. But Uganda, because we've seen the opportunity for money, somebody comes up and says, we have to test you here, and you wait a certain number of hours before we clear you to go. But you had a test from whichever country you came from. Those tests are valid for 72 hours, for crying out loud. There is no flight that lasts 72 hours, so there is no need for that test, but somebody is making money. Everywhere, people are making money, and you've had that, and it's a whole, there is a lot of COVID profiteering. And now once it goes into the profiteering, then everybody wants in on the act. So the hospitals are just getting in on the act. I mean, by the looks of things, it would be cheaper. It will soon be cheaper to treat cancer than COVID. I mean, where is the logic in that? There is none whatsoever. But because people see this is where the money, so first deposit this amount of money, first do what? Let me tell you something. And then even when you deposit the money, what treatment is being given for COVID? If you need oxygen, that's a totally different thing. And maybe there you really are at the massive. But what treatment is being given in those hospitals? And what is it worth that amount of money? People also have to gauge themselves. You see, when Ona is saying his children are scared, you think I can let my children watch this news where it's talking about COVID from beginning to end? They don't. Even I stopped watching news in March 2020. Because I realized the only thing people are talking about is death. Me, I'm alive, and I'm still alive. I'm still in town. So I don't want to project death on myself or on the people around me. So I know where to get my news.
Okay.
Okay, I'm not saying, of course, there is a lot of news we watch. Don't get jittery, because when it's not COVID, I enjoy watching news. But the truth is, when the headlines, this what I say, hey, okay, have yourselves a nice evening. Let me find something else to do that is uplifting.
Okay.
Because I have that responsibility. But now, going back to your question, Solomon, of the hospitals, the whole COVID profiteering, the whole venture, okay, the whole COVID thing, started a long time ago, and I am telling you, I have seen buildings rising up in town, and I know they are owned by people who are getting COVID money. I'll tell you that our national debt was 47 trillion in March 2020. It is now 67 trillion. I will not say all of it has been taken, you know, for COVID purposes. Of course, there are other things that have been taken. But imagine rising in 1 year, just over a year, by 20 trillion Uganda shillings. And much of it has been taken in COVID response. And we don't even have oxygen.
Okay.
How much is oxygen? And we don't even have any serious government response. And we are not going to have. So the thing is, that money is going somewhere, and she's saying, where did the money go? Of course we know where
so,
it went.
Okay, all right, guys, it's so...
Sebo omukulembeze w'eggwanga ekya lockdown wakubye miss gamba abantu begendereza obulwadde SOPs bakole ebintu byonna bye mulagira naye toggalira abantu. House arrest tegenda kuyamba. Abantu bafa depressions, abantu bafa obwavu, abantu bafa endwadde, abantu abalina endwadde nga diabetes biki abatali bagagga, eyo death sentence. Bafiireeyo kati omanyi sukali yewuledde kati funa akayiso manya kati akendedde kati kola ki kati obeerawo ku pressure because omuntu omusajja ng'alina amaka nga talina sente oba omuggyeko obusajja bwe because omanyi kyekitegeeza okutuulawo ng'abaana bakutunuulira enjala ebaluma naye ng'olina emikono gyo naye nga bakuggalidde mu nnyumba oli mulamu olina amagulu olina emikono walibadde ogenda n'okolera abaana bo ne balya naye nga bakuggalidde ewaka kakati nze bibyo ebinnuma kati singa kibadde kisoboka ne bakwata sente ezo ne baziwa abantu ne zibatuukako kyalibadde kirungi however sikisuubirayo because abantu abaziga bamanyi however engeri gye tumanyi nti wajja kubeerawo obuzibu awo bujja buwulira ate namwe mukimanyi basumulula abantu sebo omukulembeze w'eggwanga sumulula abantu ennaku 44 ze wataddewo enjala ejja kubessa abantu nga bafudde endwadde sumulula abantu bagende bakole covid bulwadde bujja kutambula bujja kusaasaana ekirungi abantu 99 ku 100 ababufuna bawona okusinziira ku statistics ezammwe eza Ministry of Health si zange kakati since covid tali omu ku bintu 10 ebisinga okutta bannayuganda top 10 kati obwavu bujja kutta abantu nga mulwanyisa covid ekisooka abantu bangi abaafuna covid ne bawona bangi bayitirivu n'abantu bemugambye 7,000 mwaka kebera kyemanya abantu abafunye covid bali miliyoni tebagenda bakebera naye abamu bejjanjabisa ne bawona ne baba bulungi kakati obulwadde buli wano kubeerawo buli naffe tebulina gye bulaga tetugenda kudduka ng'ate tudduka obulwadde obutambulira mu bbanga so kati obulwadde buli wano naffe sumulula abantu bagende bakole eno police state eya buli omu okubeera ku bunkenke teri amanyi kiddako kigenda kudeetera abantu bangi okufa mpozi nga kyoyagala abantu baffe naye nga bw'oba oyagala abantu okubeera abalamu tetugenda ku covid tannatuuka ku levo etuleetera kuggala bantu nakufiisa abantu baaliwonye singa badde basobola okubeera n'obusobozi obutuuka mu malwaliro okubajjanjaba endwadde ezisobola okujjanjabibwa si endwadde ezisobola okujjanjabibwa nga zirina eddagala naye nga abantu badde bafa endwadde ezo lwakuba tebasobola kutuuka ku basawo tebasobola kutuuka mu ddwaliro so n'olwensonga eyo ekya lockdown wakoze ensobi nnene sumulula abantu sumulula eggwanga tugende tukole sente zaffe ezo eza nabbanja bwe zinajja zijje bwe zitajje zirekeyo naye tusumulule tugende tukole ezaffe.
I hear you to a certain extent, and I think we're learning our lessons maybe the hard way. But Joseph, let me draw you in the conversation of admissions in different hospitals. Agatha hinted on it. The problem is there are so many hospitals currently where you have to deposit at least 15 million upon admission. some hospitals charge 5 million shillings a day. Someone tweeted and tagged me and said that their patient died, but they have refused to give them the body because they have not been able to pay the 25 million that the hospitals are demanding. The situation is really dire. In public hospitals, most of them are full, and other people are complaining that it's for sale. You have to pay some little money to get you onto the beds. It's a crazy situation. Do you think government needs to come in and manage the hospitals?
Government have been the biggest beneficiaries of the COVID. These people are just catching up with the whole beneficiary thing. There is not going to be any serious solution from government. Let's be honest about it. It's like we don't live in Uganda. Here is the thing. Since COVID started, there's been a lot of profiteering, and not from hospitals. Hospitals have only just gotten in on the act. Okay, there's been plenty. Right now, I'll tell you this. If you fly from Kenya, you have to have a COVID test certificate. You fly into Uganda, a flight which takes less than 1 hour, you have to come here and pay 250,000 shillings to test you. All the people with whom you were on the plane were tested. It is a money-making venture. It's only in Uganda. If you come from Uganda with a negative COVID certificate and fly into Kenya, nobody is asking you to be tested. But Uganda, because we've seen the opportunity for money, somebody comes up and says, we have to test you here, and you wait a certain number of hours before we clear you to go. But you had a test from whichever country you came from. Those tests are valid for 72 hours, for crying out loud. There is no flight that lasts 72 hours, so there is no need for that test, but somebody is making money. Everywhere, people are making money, and you've had that, and it's a whole, there is a lot of COVID profiteering. And now once it goes into the profiteering, then everybody wants in on the act. So the hospitals are just getting in on the act. I mean, by the looks of things, it will be cheaper. It will soon be cheaper to treat cancer than COVID. I mean, where is the logic in that? There is none whatsoever. But because people see this is where the money, so first deposit this amount of money, first do what? Let me tell you something. And then even when you deposit the money, what treatment is being given for COVID? If you need oxygen, that's a totally different thing. And maybe there you really are at the massive. But what treatment is being given in those hospitals? And what is it worth that amount of money? People also have to gauge themselves. You see, when Ona is saying his children are scared, you think I can let my children watch this news where it's talking about COVID from beginning to end? They don't. Even I stopped watching news in March 2020. Because I realized the only thing people are talking about is death. Me, I'm alive, and I'm still alive. I'm still in town. So I don't want to project death on myself or on the people around me. So I know where to get my news.
Okay.
Okay, I'm not saying, of course, there is a lot of news we watch. Don't get jittery, because when it's not COVID, I enjoy watching news. But the truth is, when the headlines, this what I say, okay, have yourselves a nice evening. Let me find something else to do that is uplifting.
Okay.
Because I have that responsibility. But now, going back to your question, Solomon, of the hospitals, the whole COVID profiteering, the whole venture, okay, the whole COVID thing started a long time ago. And I am telling you, I have seen buildings rising up in town, and I know they are owned by people who are getting COVID money. I'll tell you that our national debt was 47 trillion in March 2020. It is now 67 trillion. I will not say all of it has been taken, for COVID purposes. Of course, there are other things that have been taken. But imagine rising in 1 year, just over a year, by 20 trillion Uganda shillings. And much of it has been taken in COVID response. And we don't even have oxygen.
Okay.
How much does oxygen? And we don't even have any serious government response. And we are not going to have. So the thing is, that money is going somewhere. And she's saying, where did the money go? Of course we know where it went.
Okay, all right, guys, it's so...
Sebo omukulembeze w'eggwanga ekya lockdown wakubye miss gamba abantu begendereza obulwadde SOPs bakole ebintu byonna bye mulagira naye toggalira abantu. House arrest tegenda kuyamba. abantu bafa depressions, abantu bafa obwavu, abantu bafa endwadde, omuntu abantu abalina endwadde nga diabetes biki abatali bagagga, eyo death sentence. Owulidde bafiireeyo kati omanyi sukali eyongedde kati funa akayiso manya kati akendedde kati kola ki kati obeerawo ku pressure because omuntu omusajja ng'alina amaka nga talina sente oba omugijeeko obusajja bwe because omanyi kyekitegeeza okutulawo ng'abaana bakutunuulira enjala ebaluma naye ng'olina emikono gyo naye nga bakuggalidde mu nnyumba oli mulamu olina amagulu olina emikono walibadde ogenda n'okolera abaana bo ne balya naye nga bakuggalidde ewaka kakati nze bibyo ebinnuma kati singa kibadde kisoboka ne bakwata sente ezo ne baziwa abantu ne zibatuukako kyalibadde kirungi however sikisuubirayo because abantu abaziga bamanyi however engeri gye tumanyi nti wajja kubeerawo obuzibu awo bujja buwulira ate namwe mukimanyi basumulule abantu sebo omukulembeze w'egganga sumulula abantu ennaku 44 ze wataddewo enjala ejja kubessa abantu nga bafudde endwadde sumulula abantu bagende bakole covid bulwadde bujja kutambula bujja kusaasaana ekirungi abantu 99 ku 100 ababufuna bawona okusinziira ku statistics ezammwe eza Ministry of Health si zange kakati since covid tali omu ku bintu 10 ebisinga okutta bannayuganda top 10 kati obwavu bujja kutta abantu nga mulwanyisa covid ekisooka abantu bangi abaafuna covid
go and vaccinate. In the meantime, let them survive. You're not going to vaccinate dead people who have died of hunger, like Katongole. So let the people go and live, and let the when the vaccinations come, they will encourage people to go and vaccinate. Those who are interested in going to vaccinate. So the lockdown is absolutely useless.
Former presidential candidate Joseph Kabuleta, very knowledgeable man with whom we've been having this conversation, largely centering around government's interventions during this COVID-19 induced lockdown and pandemic as a whole. Thank you very much, sir, for having made the time. Really need such people like yourself coming to shine a light on what is happening within this country. Thank you.
You're welcome. And I also want to thank, are we ending?
No. And you also want to thank?
I also want to thank the media because now they are actually bringing to light the plight of suffering people.
Indeed.
I've been reading the media, I've been reading the mainstream media, I've been watching television, and you people are bringing to light the suffering of people, because we don't want them to suffer and die quietly.
Thank you very much.
So that's a compliment to the media people.
Thank you very much. That's why we left the mansions and we decided to go to Uganda. Let's now go to NTV and talk to Mr. Ivan Malunyolo and get an update on the Eid al-Adha celebrations within that jurisdiction. Good morning, my brother. What's the latest?
Well, a very good morning to you.
n'abantu b'emugamba emitwalo 7 mu akakebera kyemanya abantu abafunye covid bali miliyoni tebagenda bakebera naye abamu bejjanjabisa ne bawona ne baba bulungi. Kakati obulwadde buli wano kubeerawo, buli naffe, tebulina gye bulaga. Tetugenda kudduka ng'ate tudduka obulwadde obutambulira mu bbanga. So kati obulwadde buli wano naffe, sumulula abantu bagende bakole. Eno police state eya buli omu okubeera ku bunkenke teri amanyi kiddako kigenda kuleetera abantu bangi okufa, mpozi nga kyoyagala abantu baffe. Naye nga bw'oba oyagala abantu okubeera abalamu, tetugenda ku covid tannatuuka ku levu etuleetera kuggala bantu na kufiisa abantu baliwonye singa badde basobola okubeera n'obusobozi obutuuka mu malwaliro okubajjanjaba endwadde ezisobola okujjanjabibwa, si endwadde ezisobola okujjanjabibwa nga zirina eddagala naye nga abantu badde bafa endwadde ezo lwakuba tebasobola kutuuka ku basawo, tebasobola kutuuka mu ddwaliro. So n'olw'ensonga eyo ekya lockdown wakoze ensobi nnene. Sumulula abantu, sumulula eggwanga, tugende tukole sente zaffe ezo eza nabbanja bwe zinajja zijje, bwe zitajje zirekeyo, naye tusumulule tugende tukole ezaffe.
My brother, you asked me that question, but whatever
sebo omukulembeze w'eggwanga ekya lockdown wakubye miss gamba abantu begendereza obulwadde, SOPs bakole ebintu byonna bye mulagira, naye togalira abantu. House arrest tegenda kuyamba. Abantu bafa depressions, abantu bafa obwavu, abantu bafa endwadde, abantu abalina endwadde nga diabetes biki abatali bagagga, eyo death sentence bafiireeyo. Kati omanyi sukali eyongedde kati funa akayiso, manya kati akendedde kati kola ki, kati obeerawo ku pressure, because omuntu omusajja ng'alina amaka nga talina sente oba omugigyeko omusajja bwe, because omanyi kye kitegeeza okutulawo ng'abaana bakutunuulira enjala ebaluma naye ng'olina emikono gyo naye nga bakuggalidde mu nnyumba, oli mulamu, olina amagulu, olina emikono, walibadde ogenda n'okolera abaana bo ne balya naye nga bakuggalidde ewaka. Kakati nze bibyo ebinnuma, kati singa kibadde kisoboka ne bakwata sente ezo ne baziwa abantu ne zibatuukako kyalibadde kirungi. However sikisuubirayo because abantu abaziga bambamanyi. However engeri gye tumanyi nti wajja kubeerawo obuzibu awo bujja buwulira ate namwe mukimanyi. Basumulula abantu. Sebo omukulembeze w'eggwanga, sumulula abantu ennaku 44 ze wataddewo, enjala ejja kubessa abantu nga bafudde endwadde. Sumulula abantu bagende bakole. Covid bulwadde bujja kutambula, bujja kusaasaana. Ekirungi abantu 99 ku 100 ababufuna bawona, okusinziira ku statistics ezammwe eza Ministry of Health si zange. Kakati since covid tali omu ku bintu 10 ebisinga okutta bannayuganda top 10. Kati obwavu bujja kutta abantu nga mulwanyisa covid. Ekisooka abantu bangi abaafuna covid, ne bawona bangi bayitirivu n'abantu bemugambe emitwalo 7 omwaka kebera kyemanya abantu bafunye covid bali miliyoni tebagenda bakebera naye abamu bejjanjabisa ne bawona ne baba bulungi. Kakati obulwadde buli wano kubeerawo buli naffe tebulina gye bulaga tetugenda kudduka ng'ate tudduka obulwadde butambulira mu bbanga. So kati obulwadde buli wano naffe sumulula abantu bagende bakole. Eno police state eya buli omu okubeera ku bunkenke teri amanyi kiddako kigenda kuleetera abantu bangi okufa mpozi nga kyoyagala abantu baffe naye nga bwoba oyagala abantu okubeera abalamu tetugenda ku covid tannatuuka ku levu etuleetera kuggala bantu nakufiisa abantu baliwonye singa badde basobola okubeera n'obusobozi obutuuka ku malwaliro okubajjanjaba endwadde ezisobola okujjanjabibwa si endwadde ezisobola okujjanjabibwa nga zirina eddagala naye nga abantu badde bafa endwadde ezo lwakuba tebasobola kutuuka ku basawo tebasobola kutuuka ku ddwaliro. So n'olwensonga eyo ekya lockdown wakoze ensobi nnene. Sumulula abantu sumulula eggwanga tugende tukole sente zaffe ezo ezanabbanja bwe zinajja zijje bwe zitajje zirekeyo naye tusumulule tugende tukole ezaffe.
Katabi Town Council wa Kiso